So you really need to try to research, when you're doing your research, to try to figure out what the person's residency training was in. And it needs to be something that leads you to the plastic surgery track. It should not be a dermatologist, a OBGYN, a family practitioner, a general surgeon. Well, if it's a general surgeon, because general surgery is a pathway that you can end up in plastic surgery. So some plastic surgeons, a lot of the best plastic surgeons, they did a full general surgery residency first and then did a plastic surgery fellowship. The fellowship is 2 to 3 years after the general surgery. So if they did general surgery, you just need to dig a little deeper and see that they did plastic surgery. But the simplest way to know if it's a plastic surgeon or not is to go to the American Board of Plastic Surgeons website, American Board of Plastic Surgeons, and type their name in and see if they're board certified in plastic surgery, not cosmetic surgery, in plastic surgery. Cosmetic surgery board is fake, and it's full of dermatologists, family practice doctors, OBGYNs, all the people who are trying to trick you into thinking that they're real plastic surgeons because they just want money. And you're not going to fall for that this year, because you're going to make sure that your doctor is a real plastic surgeon. Hi, Michelle. Dr. Michelle. So that's what I want you guys. I really want you guys to, number one, check your motivation for why you're getting surgery. If you don't realize that you're already fierce and fabulous, whether you get this surgery or not, then don't get the surgery until you realize that. So then you don't do desperate things to get it, and understand that your life, you're not about to change your life, and stuff is not about to just all of a sudden just be different for you because you got a surgery. No. If that's the way you're thinking, rethink it. 2, make sure your plastic surgeon is a plastic surgeon. Make sure your plastic surgeon is a plastic surgeon. Make sure your plastic surgeon is a plastic surgeon. Please make sure your plastic surgeon is a plastic surgeon. Yes. Okay, number 3. Don't rationalize with all the other people out there who are doing all these crazy rationalizations. So what I mean by that is one thing that I hear people say that drives me crazy. Death is a normal complication of plastic surgery. It's not. Death is not a normal complication of plastic surgery. Yes, with any surgical procedure, actually any medical procedure, technically you could die. But it is not normal for a person to have multiple deaths when they practice cosmetic plastic surgery. It's not. Many of the people who train me, like, literally have had no deaths, and they've been doing cosmetic plastic surgery for 20 and 30 years. Like, it's not normal. And the times that I saw people die in my training in plastic surgery, they were on the verge of death before plastic surgery even came into picture. You know, it's like heart patients and cancer patients and stuff like that. It is so, it's supposed to be so rare to lose your life from a cosmetic plastic surgery procedure. But it's been so much of that happening in certain groups, like certain doctors who are, in my opinion, unethical and doing things, pushing the envelope way too much, and they have a track record of people dying. That is not a place to go, because that's not normal. So when you hear somebody saying, well, you know, that's a risk of surgery and that's bull crap. That's bull. It's not. Yes, technically it's a risk of surgery, but saying it in that way implies that it's kind of normal, and it's actually not. And if it was normal, let's just say for a second that dying from cosmetic plastic surgery is actually a normal, acceptable complication. My question to you is, if you know that, why would you even want to get it? Because there's no butt, boob, or stomach good enough to me to die, and my boys don't have me as their mother. Like, there's no way. I don't care how many stretch marks I got on my belly and how loosey-goosey the skin is. Me laying down thinking that there's a real chance that I won't wake up, and I got 2 children who need me, and brothers and sisters who love me, and a mama who's still alive and love me. Like, that is crazy to me. Like, if you realize if you think that is legit a normal complication, you shouldn't even want it. So we're back up to number 1. What was your motivation for wanting the surgery in the first place if you're willing to die for it? It should be completely like a fluke, like, oh my gosh, I can't believe this, I lost a patient. Like, it shouldn't be like, oh, another person died, well, you know, that's a risk of certain. No, it's not. It really should not be that nonchalant. That's tragic. And when happening serially, meaning more than one, and you got a string of dead bodies behind you as a surgeon, I'm questioning your ethics and what it is that you're doing to have this keep happening, because it's not normal. So y'all remember that. It's not normal. And if it was normal, why do you want it? And then the other thing that's really important for you enjoying your results is not comparing yourself to other people. This, I'm sorry about all the coughing. This right here is another, I guess all of these things drive me crazy. That's why they made it to the list. So people will, we all start with different stuff. We have different tissues. We have different physiology as far as the way we heal. We start from different sizes, heights, thicknesses of skin, amount of fat, like so many things that are just different. And so people will be having like these wish pics and, you know, looking at other people on Instagram and Facebook and stuff and like dreaming of that person's body, dreaming of their body looking like that person's body. And that is a setup for failure. Because if you're going in with a mind of coming out looking like another person, that's like not a healthy way to start. You should be always and only comparing yourself to yourself. So sometimes people can't even enjoy their result, even though it might be a great result, because they're too busy comparing their result to somebody else's result. You cannot compare your after to somebody else's after when you have completely different befores. So, I mean, I saw a lady today and she had put up a picture and was complaining about her result. And I'm like, that is a good tummy tuck. Like, it was a good tummy tuck. So good, actually. It's not common that I look at somebody's tummy tuck and be like, dang, if I need a tummy tuck, that's where I'm going to go. And that was one of them times where I was trying to figure out who her surgeon was, because I was like, that's a person that I would consider if I end up needing a tummy tuck. That's how good it was. And she was complaining because she's too busy comparing herself to other people. Can fat necrosis heal? No, it's dead. Dead stuff don't heal. Dead stuff is dead. That's why you don't want to get it. So fat necrosis leads to scarring, and it has to be cut out. If it can scar over, but it's not going to just come back to life. Your body will like kind of scar it in. Yeah, Sabrina Bowers, don't compare yourself to other people, honey. It's just bad. And it always it's hard because it's hard. Like, it's not even fair to the surgeon when people are putting those types of expectations on themselves and on the surgeon to make you look like another person. Like, that's insane. Compare yourself to yourself. How did you start and where are you now? That's what you should be comparing yourself to. Yourself, not somebody else. Given how intensive surgery is, my surgeon said I was crazy for allowing him to perform the surgery. That's a weird comment. Like, I don't think that's crazy. And if he thought it was crazy, then why did he do it? If somebody asked me to do something that I think is crazy, I'm not doing it. So that's that statement right there. I don't even understand that. And I'm looking at that doctor with the side eye. Because if they thought you were crazy, they shouldn't have cut you. Like, that doesn't even make any sense. I've done some talks about surgery in the Dominican Republic before, and folks got mad as heck at me. But I'll just tell you that, you know, one of the things that happens there is some of the infections that people get are bad, and there's no antibiotics. Like, it's resistant to the antibiotics that we have, and then women will come back here with bad infections that we can't clear, and be on disability and all kind of other stuff because of infections coming out of the Dominican Republic. So the CDC issued a statement twice this year warning people against plastic surgery in the Dominican Republic because of the infections. Yes, baby. You need to give me a hug right now while I'm doing this video, huh? It's Bradley, y'all.
Hi, Facebook. My name is Bradley. And I'm my mommy's girlfriend.
You mean boyfriend? He said my name is Bradley and I'm my mommy's girlfriend. Bradley's my little boyfriend. Okay, come on, B-Pops. All right. So, I mean, I think that's something to think about. B-Pops, Miss Farron said hello.
Hello, Farron.
He said hello, Miss Farron. Miss Shamika said hello.
Hello, Miss Shamika.
He said hi, hello, Miss Shamika. Yeah, surgery, tummy tuck surgeries are not crazy. They're great. It's a great operation. I don't understand that right there, Eileen. I don't get it. There's not a crazy surgery. It's a great surgery. As long as it's done by a surgeon, a plastic surgeon. Yeah, so what somebody was asking me about the Dominican Republic. Yeah, so that's my major issue with that. And then, you know, some of the surgeons in the Dominican Republic have a lot of deaths, but there are some surgeons in the United States who have that too. And so whether they're in the Dominican Republic, the United States, Colombia, Mexico, Australia, wherever, if they have a chain of dead bodies behind them, don't go there. Like, you shouldn't be dying for no plastic surgery. It's ridiculous. Dean, you need to talk to your surgeon about that. You're still like in the acute post-op period, so you should talk to your surgeon about the concerns you're having if you're only 2 months out.
Facebook.
Thank you, Shar. Oh, sorry.
Facebook.
Okay.
Facebook. This is me.
That's Bradley's Facebook.
Bradley. But I'm elf.
Yeah, you're an elf. All right.
So.
Okay, B-Pops.
So Facebook.
Okay.
Thanks for seeing.
Yeah, they like it, B-Pops. They thought it was so cute. All right. Let mommy finish your video. Jennifer, you saw what in a few groups and it seemed scary. Stop, Bradley Pop. What did you see in a few groups that you thought was scary, Jennifer? Bradley.
Yeah.
Excuse me. Melanie, that's a great question. And I'm actually not sure how you can find out. You can ask them. People have asked me that before, and I answer quickly, because I haven't had any deaths. But if